So I'd love to start off by hearing a little bit about you and your expertise.
I, as I just mentioned, I got a PhD in sociology at University of Maryland, and my specialized like a specialized area is like hills, like social determinants of hills. And before that, I had a bachelor degree and a master degree in China. One is about like a sociology, and another is about demography. So in general, my research area is really focused on how our like social determinants affect people's health, affect health disparities, especially in disability and mortality and some chronic conditions and also some like depression or subjective well-being. So that's like the basic area I'm doing both in PhD and currently.
And what made you decide to study chronic pain's influence on disability prevalence?
So yeah, so that's like a long story. I did a lot of study about the disability rates at the population level. So the basic thing is like we want to track the changes of disability prevalence over time. So we know, for example, in the US, there is a decline trends in 18th and even 19th. But since the 2000s, we observed that this kind of decline has like slowed down or even like stopped or even rising in some disability measures. So we are examining what kind of factors are driving this kind of like worsening trends. So I had a paper during my PhD. We found some chronic conditions and pain. They are like some like a very very like significant driving factors. So that's like the background. I didn't do much pain research before that, but because of that paper, we found pain is like a really important factor. So we dive into that part of literature or research background, and we found okay, there is a like a amazing research team at the University of Buffalo. So then during after I graduated, I just reach out, okay, if there is this kind of research area and opportunity and a postdoc there. So I just go to apply for that and interview and a good fit. So that's why I'm here.
Tell me a little bit more about the study you just completed. What were you hoping to learn and what were the results of the study?
We found the disability risk, especially among middle-aged adults and some older adults, has ceased to decline or even rising. So at the same time, we know pain is increasingly recognized as a public health crisis. So we wanted to know if there is a link between two phenomena. So I think the most important finding of our paper is that we found a lot of people with disabilities attribute the cause of their disability to pain. So that's the first big findings. And then we found the people attribute disability to pain has been rising like very, very fastly. For example, we found the prevalence of disability. We use because disability has a lot of different kinds of measurement. We use functional limitation as our measurement. Functional limitation means physical difficulties in doing like walking several miles or lifting 10-pound objects or climbing stairs, these kind of things. We found that the prevalence of functional limitation rising from like 43% to 50% over the past 70 years. And 40% of that increase could be attributed to rising pain prevalence. So that's a lot. So we did some like a simple estimate. We found during 2002, 2018, there might almost about like increasing 10 million people in the US, like middle-aged and older adults US, attribute their disability to chronic pain. So like it's like a large number. It affects so many people in the US.
Did you also find any information about why that rate of chronic pain may be increasing? Were there any information about like any rise in painful conditions?
So the rise in the cause of that pain sense is beyond the scope of that paper, but we do have some other papers in our research team trying to explain. So firstly, the why pain happens. So it's still not well understood even in like medical like a researcher, we still don't understand why some pain happens because sometimes people just feel pain with no medical conditions. But more and more evidence shows that pain is quite related to their life experience. For example, the stress in their daily life and some like stressful life events, their work, their family. So this kind of things is a big contributor. So that's why we are trying to link the social factors to pain because we found it's not just the medical story, it's like a social life story. We did a lot of things about disparities in pain. So people from low income families or minority groups and women, they experience more pain and the pain are also more harmful to them. They are more easily to be disabled because of pain. So that's also related to like our healthcare systems, management tools. So a lot of things are contributing to the pain story.
How do you think this study might influence or impact how we approach disability and chronic pain in the US?
So firstly, our study is like the first systematic study using national data to highlight pain as a contributor to disability trends. Even in our team's other studies, we found pain is associated with many kinds of disability. For example, in this paper, we focus on functional limitation, but in other papers, we found pain is related to inability to work, inability to do leisure and like participate social activities. So the pain is very, very like it affects a lot of disability measures. So we want this paper as a call to action for healthcare provider, policymaker, and also researcher to work together to tackle this growing challenge, especially when we think about a lot of disparities in pain and disability. So we need to have more like policies or interventions to make. We do have a lot of tools to, for example, to manage our pain conditions, to reduce pain's influence on disability. We can do as well as know like physical activities, healthy lifestyles, and we also have a lot of pain management tools from like a healthcare provider. But the thing is that we should make it like more available to people from like a disadvantaged group. So that's important. We do have tools, but it's heavily like unevenly distributed across population. So that's a big challenge.
What are some things that you hope government officials and healthcare officials and the different people who have the ability to make change for these populations? What are some things you hope that they're thinking about after reading your study or maybe questioning?
I think the biggest thing I'm thinking of is pain management. So honestly, we don't have like a 100% like effective like pills or something to pain has caused a lot of like burdens of diseases. We know a lot of things about opioid use. So pain do cause a lot of like social consequence in our like US society. But a lot of pain management things can be done by patient side. For example, as I just mentioned, the like lifestyle, the physical activity, and also a lot of things can be done by the like a society side. For example, how to make people's work life and family life less stressful. We need a lot of like for example family supportive policies, like work related policies, support people from like a disadvantaged group, from like for example for mom care for children, and at the same time be responsible for a lot of work. So this kind of stress we can do a lot in this side, even though we don't know like the mechanism of pain currently. I don't know because I'm a social researcher. I heavily rely on that social part to do something to improve people's life.